Hello, I am Umanath. Welcome to Preventive Healthcare. This is a very interesting video which will help us to learn one of the most valuable input to know about our vital sign. This learning will help you to attend people or decide when somebody is having a very critical condition. Are we doing the right thing in terms of giving the right medical attention? For example, when a person is going through sudden breathlessness and panting, gasping, especially when he is at rest, indicates certain risk. Knowing this video will give you knowledge and information and improve your understanding to take the right steps so that you don't lose the golden hour to save a life. Let us understand certain basic things first. In fact, we can observe and understand from the Mother Nature. We all know the beautiful hummingbirds. They tell us a very interesting story. Their respiratory rate, nothing but how many times they breathe per minute, the full cycle of breathing. Inhale till exhale. Normally, their breathing rate is 250 times per minute when they are at rest. When they are active, it can go even above 1500 per minute. They are one of the species having high breathing rate. Their lifespan is 3 to 5 years. What it means, when the breathing rate is high, the lifespan is small. That is how the God has created us. Let us understand another one. The turtles, tortoises, they tell a different story. Their respiratory rate, that I mean the breathing rate per minute, varies between 1.5 to 3.5. They have a very longer lifespan. Their lifespan is somewhere from 150 years to 400 years. They live longer because their breathing rate is slower. As a human being, where do we stand? Whatever we are discussing in this video is for an adult above 18 years. This respiratory rate should not be applied for teenagers, kids and children. Okay, I reiterate again, the entire video, all the content that we are going to discuss is for adult humans. Okay. A good respiratory rate, the breathing rate for a human being as an adult is between 12 and 16. That's a very good level. When someone can maintain this breathing rate stable, especially when we are at rest, that is what a good indicator is. A lifespan of 80 to 100 years is what is designed for us. The respiratory rate can vary when you are active. For example, when you are doing exercise, or when you are doing jogging, or when you are involved in active physical work. But the good way of measuring is to measure when we are at rest. That is what will help us to know the fact where do we stand. That measurement is to be taken into account when we are going through this video. How this breathing rate is affected, it is important for us to know actually. There are two important systems. One is our heart, cardiovascular system and the blood circulation system. All these things together I consider as one single system. This includes pumping of the heart, blood flowing through the blood vessels throughout our body, the entire system as such. The second important system is respiratory system. We inhale and exhale, and our lung does some activity of taking oxygen from the air that we breathe in. When these two systems are at stress, when these two systems are having problems, when these two systems are in distress, it can affect the respiratory rate, it can affect the breathing rate significantly. What way it can affect? Either it can cause increase in the respiratory rate or it can cause drop in the respiratory rate. When this happens, there are certain type of people who are at high risk. Who are they? There are some who are having problems with the heart, like heart palpitation, elevated heartbeat, and then echo scan indicates that their heart pumping is poor, and those who are having blood pressure which is not under control. Sometimes patients are having pacemakers. Certain people have enlarged heart, we call it as cardiomegaly, and any other important cardiovascular issues. So those who are having these kind of issues already, they are at risk in terms of having impact on the respiratory rate. So awareness of this particular point is very important if you belong to this category or anyone who is known to you in your family or anybody else. There is also one more group of people who are also at risk. Those who have reduced lung capacity, those who are suffering from chronic asthma and wheezing, those who are having infections like pneumonia, lung infections like pneumonia or bronchitis, those who are going through long-term issues like tuberculosis, infections like tuberculosis, and immunosuppression conditions like HIV/AIDS, and any other lung diseases like COPD, chronic obstructive pulmonary disease. So all this group are having issues in the respiratory system. I mean, lung capacity is less, having chronic asthma or wheezing, having congestion in the chest with some infections like pneumonia or bronchitis, and bacterial infections like tuberculosis, and immune compromising situations like HIV and AIDS, and long-term lung issues like COPD. So it is also important for them to know what their respiratory rate is when they are at rest. That can give a very good indication of your long-term health. In addition to this, anyone who is tested COVID positive, anyone whose test result says that coronavirus positive, if they develop breathing difficulties or if they develop chest pain or any chest discomfort, or if they develop recurring cough, then they are also at risk in terms of having impact on the breathing rate. So it is important for anybody who is having COVID positive report to understand this very important valuable input. Knowing this at the right time can help you to approach the doctors and the hospital well in advance when you need medical attention. Sometimes not knowing this, you may lose the golden hour. Sometimes you may reach the hospital or the doctor's attention little later. I think that is not desirable. I want you to be proactive so that you know what you need to do. You know when you need to approach the doctors and the hospitals. There are also other patients who are having issues like sleep disordered breathing. The meaning is that they go through a lot of breathing disturbances in the middle of the night when they are sleeping. Issues like obstructive sleep apnea, central sleep apnea, they are also at risk. They need to ensure that whatever the recommendations given to them, they are following it correctly, including the usage of CPAP or BiPAP or any other support recommended by the doctors. That will help them to ensure that the disordered breathing is not happening when they are sleeping. Otherwise, they are also at risk. Now, let us understand where the respiratory rate stands. So, to give you an overall picture, there are many vital signs of our body. When I say vital signs, they tell us our overall health condition at any given point of time and help us to decide whether we need medical attention or at what time. So, some of the indicators you already know. One is body temperature. You can check it by a thermometer. Second one is pulse. Third one is what we are discussing is respiratory rate or otherwise called breathing rate. The fourth one is blood pressure. The fifth one is SpO2, nothing but oxygen level in your blood. We call it as oxygen saturation. This can be monitored with a pulse oximeter and that will give you a very clear digital reading to know. But to tell you clearly, pulse sometimes can fluctuate very quickly. When the person is tense, it can fluctuate, go up and down. Same way, blood pressure also can fluctuate. It can go on up and down, where at the time of checking, if the person is little bit disturbed internally, the blood pressure reading can also fluctuate. So these two readings sometimes can cause a condition called false alarm. I mean, it can give a result, but it may be a fluctuation. So it will be helpful for us to know some indicators which are not going to fluctuate immediately, which can give a more balanced indication of where we stand. So I am not undermining or I am not reducing the importance of pulse, body temperature or blood pressure. Please continue to monitor if it is necessary. It will also help you to make your decision at the right time when you need medical attention. But the respiratory rate, why I am stressing here is, this is an unsung hero, not very popular, but this is one of the most important parameter which we all need to know. I think there is no life on earth without respiratory rate, right from birth to death. This applies to all forms of life. So not knowing this, I feel, is a big gap in terms of our basic knowledge. So I thought we need to understand this a little bit more. Let us see. Breathing rate is always to be measured when you are at rest, preferably when you are lying down calmly in the bed. That is the best time to check. How it can be checked? Counting the full cycle of inhale, hold and exhale. The entire cycle has to be counted as one. So count these cycles, how many times the breathing happens per minute. That is called breathing rate. I repeat, breathing rate needs to be measured when we are at rest, preferably in bed when we are in a flat and comfortable position. And how it needs to be measured? It needs to be measured by counting the full cycle of inhale and exhale and count it how many times we are doing the full breathing cycle per minute. That will give you breathing rate. This is also called as respiratory rate. Both are one and the same. It is also helpful if you know one more parameter called oxygen saturation. That can be measured through a pulse oximeter. This you might have seen with doctors. This is also available for buying online in many places. And this can give an indication of whether the person is having enough oxygen in his blood. And when the oxygen level drops, the pulse oximeter reading also drops. So this small piece of equipment helps you to know the pulse as well as oxygen saturation. So when we combine the breathing rate and the pulse oximeter reading, you get a very reliable input on when you need medical attention. Let us see how it is. Okay. I'm giving a simple green, yellow, orange and red chart. This will give you clarity on anyone who needs attention because of distress in the cardiovascular system or because of distress in the respiratory system that is affecting their vital sign called breathing rate. So when you check, if you find the values are between 12 to 16, it is in a very good condition, especially at rest I am talking about, then nothing needs to be done, fine. And it can go slightly this way or that way. So the band of 10 to 18 is considered as acceptable. But when we need attention, when the breathing rate goes below 10, that means especially when the breathing rate is between 8 to 9, or when the breathing rate is above 18, I mean 19 to 25, clearly indicates that the person is going through distress, respiratory distress, distress in the cardiovascular system, or a combination of both. Then he needs medical attention. So this is a very good early warning indication where it says that the person needs medical attention. That means you can approach the doctors and the hospitals if it is necessary. Then the red zone indicates that when the breathing rate drops below 8, I mean 7 and below, or when the breathing rate goes above 25, then it is indicating a very serious warning. The person may need a critical care or a life support or any urgent support from the medical community. Wasting time may be not desirable. As quickly as possible, the medical help needs to be sought. Okay. So understand these four zones, which will help you to take help you to understand the warning at the right time, and also help you to take necessary medical help quickly, which can save lives. And important point to note, when the breathing rate is increasing, at the same time the person is experiencing breathlessness, panting, gasping, and also oxygen levels are dropping with the pulse oximeter reading, it is a very important warning sign. Okay. Same way, when the person's breathing rate is reducing and also pulse is slowing down and oxygen levels are also reducing, this is also an important warning. The first warning, when the breathing rate increases, is saying that the person is fighting for his breath. The second warning, when the breathing rate is going rapidly low with a low pulse and also low oxygen level, please note that the person is unable to fight the battle. That means he has started losing the battle. So both are important. Both are two extremes. The first one is the person's body is trying to fight to the best possible level. The second situation is where it is unable to fight. Already there are indications that the battle is likely to be slipping out of his hand. So in both these situations, it is very important for us to seek the urgent medical help from a doctor or from a hospital, so that this can become a life-saving moment for an individual. Knowing this will empower you with important knowledge, important understanding about the vital parameter. This can help you or help anybody whom you know. And for anyone who is not sick, not having all these problems now, but if you want to maintain your good breathing rate, which is already in a good band like 12 to 16, or already in an acceptable band like 10 to 20, 10 to 18, you can follow some good practices. The good practices are: have good ventilation in the place of your work or in the place of your living at home. And the second important thing which can help us to maintain a very good breathing rate throughout our life cycle is pranayama, a wonderful science. Exercise also helps us to achieve and maintain good breathing rate. And a good balanced diet and nutrition helps you to do this even better. And all these things helps you to build a strong immune system. Okay. And remember, preventive health care is what can help you to maintain your breathing rate from cradle to grave, and you can also enjoy a healthy lifespan and a longer lifespan as designed by God. Finally, I would like to emphasize pranayama is considered to be the topmost science on breathing rate ever done so far. This can help you, this can give you a wonderful way of how you can regulate, how you can improve, and how you can stabilize the breathing rate by practicing it. And this is one of the best technique that we all know on prevention. When combined with a good diet and a good micronutrient supplementation, it can do wonders in terms of maintaining a healthy lifespan. To sum it up, I bring in a quote from Albert Einstein. Look deep into the nature and then you will understand everything better. Look deep into nature and then you will understand everything better. This video is one such an attempt to make sure that you get the right input in the simple and easy way so that you get it right and you make use of it, which can help you to save lives, which can help you to get the right warning at the right time, and you are empowered with the right knowledge. Thank you for watching this video. If you find this video helpful and valuable in improving your health and quality of life, in taking the right decisions at the right time, when to seek medical attention, I request you to share, forward, and communicate to others so that many can get benefited. You can also subscribe to get intimation for such enriching videos in the future. Whatever inputs that we have discussed and understood in this video are all intended to improve your knowledge, improve your understanding, so that you understand your body, so that you understand your vital signs. That in turn helps you to take the required help from the doctors and the hospitals at the right time so that you are able to serve yourself better. You are also able to serve others better. Thanking you. See you in the next video.